Hi, my name is Cormac Ryan. I'm Professor of Clinical Rehabilitation at Teesside University. I'm also a community pain champion for the Flippin Pain campaign. I'm going to give a quick insight into the plenary session that I presented at the British Pain Society's annual scientific meeting this year, entitled Pain Science Education, a Public Health Approach. So pain is a huge problem. What have we been doing to try and address this problem for the past 30 years? We've been taking a predominantly biomedical approach with increases in things such as scans like MRIs, opioid prescriptions, and surgical approaches. However, despite considerable increases in these biomedical interventions, very little improvement has been seen in terms of the prevalence of persistent pain. If anything, we're continuing to see an increase in the prevalence of persistent pain and its associated disability. So why do we persist taking this biomedical approach in light of the fact that it's not really working and it's contrary to what evidence-based guidelines say, which recommend we move towards more active physical and psychological therapies rather than these biomedical interventions? Well, I would argue that a large part of this is due to public and indeed healthcare professionals' general understanding of persistent pain. I think most people have an understanding of pain that's deeply rooted in a structural pathology understanding of pain. That pain is due to tissue injury and that the amount of tissue injury is equal to the amount of pain that people experience, and that persistent pain means that the tissue injury is not healed and it won't go away until that injury is fixed. Now, these are predominantly myths or misconceptions about persistent pain, and they act as barriers to good management. Without removing these misconceptions, I believe these barriers to good management will remain, and we will continue to go down the biomedical road, which has been so unsuccessful so far with respect to persistent pain. So with that in mind, I am part of a public health campaign called Flippin Pain, which is predominantly based on pain revolution in Australia, led by Professor Lorimer Moseley. And Professor Moseley has kindly contributed to the Flippin Pain campaign and supported us in so many of the things we do. The Flippin Pain campaign is funded by Connect Health, a private provider of musculoskeletal services to the NHS, and we've done a number of initiatives alongside our NHS colleagues. And the aim of the Flippin Pain campaign is to change the way that we think about, talk about, and treat persistent pain, to help people, both the general public and healthcare professionals, move away from biomedical understandings of persistent pain towards more contemporary scientific understanding of pain, in keeping with the biopsychosocial model, that pain is a biopsychosocial experience influenced by biological, psychological, and social things. And that understanding, we believe, will help us to shift towards taking a more biopsychosocial approach, a more active physical and psychological therapies approach. So we're trying to change public understanding by communicating our 6 key messages: that persistent pain is common and can affect anyone. Hurt does not always mean harm. Everything matters when it comes to pain. Medicines and surgeries are often not the answer. Understanding your pain can be key, and recovery is possible. We're trying to spread that message far and wide. If you'd like to hear more about the campaign, more about the message and why it's so important that we get this message across in a public health way to as many people as possible, please check out our website or go and watch. I think you can watch a number of our videos also on the Flippin Pain website. Thank you very much for listening, and stay classy.